Recent studies show that tooth enamel is a marker for high cortisol in the body. And it makes sense when you dripping a cortisol all day long because of the high stress level, your teeth and your bones, they lose minerals. They become more vulnerable. So that's why all patients in our practice go throughout the first consultation, a new patient experience. We check pH, and we ask patients to check the first pH of their in the morning, saliva pH or urine pH. I don't know if Dr. Lodi, you discuss it, but this is really important. It's a snapshot to see where you're at, because God created us what we need to be alkaline to be healthy. So if your mouth is alkaline, you're not going to have cavities, you're not going to have a gum disease. Once this pH changes, then that's where you start to see breaking down of a tissue. Anaerobic tendency, oxygenation. That's why we talk about ozone, and the importance ozone and oxygenation for overall health, but specifically for oral health to prevent cavities and gum disease. A diet, and you are an expert when it all things on nutrition, so I'm just going to briefly mention imbalanced processed diets, not enough healthy omega-3s, poor liver function, oxidative stress, imbalanced ANS, your nervous system. Again, going back to fight and flight mode, if we in a sympathetic overdrive, it's going to be what? Cortisol. It's going to be losing minerals, and your teeth now more prone to having cavities, more prone to having, if you heard of a term, broken teeth, or clenching and grinding caused cracks in the teeth. So healthy, beautiful teeth will have cracks. How is it possible? Because they become so soft due to minerals leaching. And of course, heavy metals. If you have heavy metal restorations, that will induce inflammation in surrounding tissues, that will really weaken your tooth structure. And sleep disordered breathing, and this is a big one. If you're a mouth breather, you introducing a lot of unnecessary bacteria and parasites and viruses, everything from the air in your mouth, and the first line of defense will be your gums and your teeth. We're supposed to breathe through the nose because they have filters that will help with ideal humidification, with ideal temperature. There's a lot of nitrous oxide receptors that will produce this very important molecule for your healing. So when we switch to mouth breathing, we're missing out on very, very important parts of it. And also nasal breathing is important for your balancing of your nervous system. So once you have sleep disordered breathing, and if you look at the spectrum of these problems, from OSA or sleep apnea to sleep disordered breathing, it starts with snoring. It starts with mouth breathing, and we'll start talking about it. But maybe just like we discussed, maybe we'll have another webinar where we talk about specifically airway in kids, airway in adults, and especially when you're on your healing journey, how important it is.